think going into it, you don't expect to get out of it as much as I did, but it's not, you think that you're going to give back to somebody, but really you're going for them to give back to you and for you to gain all these experiences. So you think that, you know, everybody says it's so selfless, but really in a way it's almost selfish, because you go and they're giving you so much and you're getting so much out of it. So we did several mobile clinics outside the outskirts of Leogán, within Leogán. So we went up in the mountains or down by the river and things like that. So we would set up, and so we had a triage, laboratory, wound care, 3 physicians seeing patients, and so you'd go in, they'd come through triage and they'd get to see patients, whether that was for routine blood pressure maintenance or diabetes maintenance, or if they had different diseases like that we could help them manage and get them temporary care for. So these people traveled 2 hours just to get to these clinics sometimes. So these older women, you see a 95-year-old hiking in 2 hours just so she can see a physician. We're complaining walking up these hills, and they're here barefoot walking on the rocks and everything. And so seeing what they have to get, what they have to go through to get health care is just absolutely shocking. And then to go to a hospital is almost worse than it was to go to the mobile clinics. Instead of here, they would just automatically take care of you, and then they would work out if you had the money to pay for it at a hospital. But there, they gave me an order set, EKG, order set for all these labs, for all these medications, IV fluids, all these things, and gave me these papers and said, you pay for them or go fill these prescriptions so we can give them to the patient. The care you give for them is still the same. How much you love that person or how much love you give to that person is still the same, whether they speak Creole or French or English. They can still feel that when you're taking care of them.